According to the 2000 census, 28% of Latino children in this country live in poverty. 58% of Latino fourth graders read below the basic level. Unfortunately, many primary care providers are limited in their ability to communicate effectively with Spanish-speaking families. So Reach Out and Read National Center has developed Leyendo Juntos, a new initiative to help train medical providers and give them the tools they need to deliver the Reach Out and Read message effectively to Spanish-speaking families.
The relationship that a family has with the person who does primary care is really at the heart of the Reach Out and Read model. When that person gives you a book, what we think is that that gives the book a special significance in the family's life, and it links the book to all those other issues about nutrition and health and growth and speech and development.
In terms of the Reach Out and Read, what I find is very valuable is that it's really a way to focus on that relationship with the parents and the patient. For example, this girl, Kelly, she was very, very interactive. You could tell that mom had done a great job of already sort of stimulating her language. She had more vocabulary than the average 18-month-old. With the Spanish-speaking population in particular, it's very difficult because I think they feel that they're obligated in society to speak English. So I think it's really nice that we offer books that are in Spanish, that they can sit down and they don't have to feel obligated to speak or read in English.
Hay cosas que tú puedes usar cuando estás leyendo con ella.
So Leyendo Juntos is a way for us to say, how can we help our providers do this? How can we help them understand their patients better, listen to their patients, and given that many of us who are trying to do this are not fluent in Spanish, how can we help providers get this message across in a way that will really work for the families they take care of?
Dr. Tomopoulos can use her limited Spanish skills to make families feel comfortable while modeling book sharing.
So when I have a Latino family in the room, I give the book to the child and sort of try to gauge how they're using the books at home. You actually can see where they are developmentally. You can see the words they're using, their naming, parts of the body and other things that they know, and it's an opportunity really to do almost like to assess their development and their language.
Está llorando, mami. Mira, se cayó. Otra vez.
Our pediatric providers are very busy. They're being asked to do more and more every single day. So the materials that are developed through Leyendo Juntos really will help them focus on specific things that they can say, specific issues they can cover that are going to be age and culturally and language appropriate for the Spanish-speaking families that we serve.
¿Habla inglés?
No, es Spanish.
¿Solamente español? So necesitamos usar el teléfono. ¿Sí? Siéntate, por favor.
Interpretation services help doctors who do not speak Spanish. Dr. Huang can communicate the messages from Leyendo Juntos using the language line.
This is a book written in Spanish, and it is written for you to read to your 6-month-old. You can speak and read to him in the language you feel most comfortable in. And if that language is Spanish, it's wonderful to read to him in Spanish.
Oh, está bien. Hace un rato a mí me dieron una dirección de una biblioteca donde yo puedo conseguir algunos libros en español para yo poder leer a mis niños.
Let's give him the book and see what he does.
A él le gustan los libros.
So one thing you can do when you give him the book is just kind of engage him with the book.
So I use the language line with my patients for almost every visit when their first language is not English, and I think it's a wonderful tool, especially when you're talking about, reading, language, the acquisition of language, kind of topics that can be a little confusing, especially when you're not sharing the same primary language.
¿Qué es este?
Oh, ya estamos aquí agarrando el libro. Estamos mostrando los bebés.
He loves the book. It's wonderful. So as a clinician here at Bellevue, we kind of see the whole range, the whole spectrum of parents. Some parents come in and they're already reading to their child while the child is in the womb. And on the other end of the spectrum, they're parents who can't hardly read it themselves. You kind of get a general gist when you first meet the parent, but we often ask about literacy level, highest grade achieved, and we kind of use that information to decide how much we want to go into the importance of reading.
We recommend reading as much as possible. We understand that you're very busy, but it's something that would be great to kind of incorporate into a